Governor Kate Brown's vaccine mandate requires healthcare staff to get vaccinated by October 18th to help control the spread of COVID-19 and its Delta variant. That leaves some healthcare workers with a difficult choice as the deadline approaches. They need to either get vaccinated or get approval from their employer on their religious or medical exception to keep their jobs.
The mandate deadline approaching has been emotional and stressful for nurses because there's definitely a little bit of a schism in the workplace. There are nurses that are unhappy about the mandate and nurses that are extremely pro-mandate.
Misha Hernandez is a representative for the Oregon Nurses Association. She works primarily with Providence Medford Medical Center. She says she believes more Providence nurses are getting vaccinated before the deadline, but says a handful are leaving the healthcare industry altogether.
There are people that have chosen to not get vaccinated and are retiring or leaving the profession, and then there are some folks that have legitimate medical reasons not to get vaccinated. But I don't know the exact numbers.
Broadly speaking, we think that more than 90% of nurses that are represented by the Oregon Nurses Association have been vaccinated, and that is a really high percentage. We also know that nurses are among the highest percentage of vaccinated professions in the state.
That's ONA Director of Communications Scott Palmer. He says the association is now focusing on what hospitals will do for their vaccinated healthcare workers after the mandate goes into effect.
What happens if 40% of the nurses in Southern Oregon decide that they don't want to stay in nursing in the next 6 to 8 to 10 months because of the pressure they're under? That is a much bigger crisis coming down the road if hospital systems don't take these issues seriously.
Hernandez agrees with Palmer, as she says traveling nurses, CNAs, and techs are only a temporary fix for the short term.
What we really need to do is invest in greater options around education, and then going back to the hospitals and talk about creating opportunities for new nurses to enter the workplace